All right, so if your low back is feeling a little bit stiff and cranky, there's a somewhat decent chance that you are tight in both the hips and or the upper back. And that tightness and lack of mobility in the hips and the upper back is causing stress in the low back and causing it to feel a little stiff and cranky. So we're gonna do a couple of moves to address both of those things. So the first move is we're gonna do a little bit of a tall kneeling hip flexor stretch where we kind of get the pelvis to tilt backwards by squeezing the glute, staying nice and tall, and then holding this position, we're gonna cross the hands over the chest and do a little thoracic mobility. So we're gonna turn the head and the shoulders. Big inhale here. Exhale, try to get a little bit more. Go to the other side. Turn, head and shoulders. Inhale. Exhale. Looks like this from the front, where we're getting nice and tall, the glutes tight, little stretch in the hip flexor here in front, hands across the chest, head and shoulders turn. Inhale. Exhale. On that exhale, we're trying to get a little bit more. Go to the other side. Turn. Inhale. Exhale. So there we get a little combination of hip flexor stretch in front and thoracic mobility with a nice breath to breathe into it and get a little bit more range of motion. 5 to 10 of those on each side. Next, we're going to go into a 90-90 position. So 90-degree angles are thereabout on both knees. If you're a little bit more comfortable in here, tighter, you can play around with that. Do what feels best for you, basically, on your knee. So from this position, we're just going to try to get up nice and tall, and we're going to go towards the back leg. Again, we can have the hands here or just in front. We're going to turn, inhale, exhale, inhale, exhale. So on that one, we're basically trying to get a little bit more every time we exhale. So we're going to get what we can. Inhale, exhale, hold it there. Inhale, exhale. So we're trying to get a little bit more of that thoracic rotation. And also as we rotate, you're going to feel probably a little bit of, maybe even a little pinching, tightness in the hip here. We're really trying to kind of drive that internal rotation on the hips. And then of course we're going to do that on the other side. Get yourself nice and tall, turning into the back leg. Inhale, exhale, just like that. So we're getting a little hip rotation, again, getting that upper back moving. So that hopefully if you have tightness in the hips and in the upper back, we're going to address that a little bit and relieve a little bit of that tension that is being placed in the lower back as a result. Thanks.